All right, new haircut. Anyway, I get this question a lot, so I did want to do a follow-up video relating specifically to safe sex, STIs, and related to pregnancy and birth and breastfeeding. First of all, remember that many STDs are treatable, so getting tested and getting treatment will help ensure that you, if you are the person who is pregnant, has a healthy pregnancy, a healthy delivery, and a healthy baby, and you don't have to worry about risk of transmission or infection, okay? But let's talk a little bit. So HIV. HIV can be passed to the fetus during pregnancy, during labor, during vaginal delivery, and breastfeeding. However, there is a lot of evidence now that shows that if someone is pregnant and HIV positive, but is on a medication treatment and has their HIV controlled, that risk is very low for transmission to the fetus. Okay, so medications reduce the risk of transmission. Again, this is the importance of knowing your status, knowing your HIV status, and knowing your status related to other STIs as well, so that you can be healthy, and especially then if you're pregnant, so that you can ensure your fetus develops correctly without the risk of an STI infection. Okay, so chlamydia. Untreated chlamydia can be linked to preterm labor and low birth weight. It can be passed to the baby in vaginal delivery, but again, this is one of those STIs that is treatable, but again, you have to know. So people who are pregnant will usually be tested for a variety of STIs, but then it's important to continue following safe sex practices throughout pregnancy so that you don't get a new infection, because sexually transmitted diseases can pass from partner to partner if both are not getting treated. Okay. Syphilis can cause miscarriage. It can cause stillbirth. It can cause the death of the newborn shortly after birth, because it can pass to the fetus during pregnancy or during birth if it's in contact with a sore. Again, this is a treatable STI, so I can't stress the importance enough of being tested and knowing your STI status, and getting an infection cleared up before birth, okay, and while you're pregnant. Gonorrhea is linked to miscarriages, premature birth, also low birth weight. It can infect an infant during delivery. When an infant passes through the birth canal, this can lead to a severe eye infection. It's one of the reasons, and not the only one, but it's one of the reasons that infants will be given an antibiotic ointment in their eyes shortly after birth, to help minimize this risk of eye infections. Herpes and HPV can be transmitted to the infant during vaginal delivery. Sometimes it's related to if there is an actual active infection. So if you have an STI, that does not mean it is 100% guaranteed. No matter what STI you have, it is not 100% guaranteed that it is going to be transmitted to the fetus during pregnancy or to the infant during delivery. But it does mean it is so important for you to know your status so you can get treated if the STI is treatable, or so that you can be on medication, possibly antivirals, antiretrovirals, if we're talking about HIV, to minimize any of the symptoms and minimize the risk of transmission so that you can have a healthy infant no matter what your STI status is. So again, no STI is a guaranteed transmission during pregnancy, during delivery, okay? But there are greater risks, and those risks increase if you don't know your status and if you don't get treatment, okay? Now, if we talk about breastfeeding in particular, those risks are a lot less, okay? Officially, the CDC recommends do not breastfeed with an active HIV infection. This, however, is somewhat controversial, so if this applies to you, I would encourage you to speak to your doctor and get their recommendations, because, again, there have been less cases of HIV transmission during pregnancy when people are on a well-managed medication regimen. With other STIs, breastfeeding is totally fine. Okay. However, the infant and pumping equipment, if you are pumping, must not touch any active sore or lesion. So if you have sores or lesions, that is going to interfere with your ability to breastfeed, because that is an active transmission site. Okay, so just take that into account if you are breastfeeding or pregnant and worried about transmission to the fetus and to the infant during and after delivery. Okay, so I hope that helps.